I would prefer a tunnel filling, and then it's an easy catch, because then I tell the patient you need the tunnel filling anyway. I enlarge the surgery about 40 minutes for an osteotomy. The full weight bearing is going to be reached 3 weeks afterwards. You're not going to lose anything, and we give you a better result. And then I would go for the slope with that patient also. Depending on the new lateral X-ray. Yeah.
Let's imagine that you have 78 rags.
So we know that
78 on long X-ray, 2 meniscus done, 1 to be operated to be stable again.
So we know the failure for ACL reconstructions is multimodal, and looking at that tibial tunnel is too shallow for me. You can just make out the femoral tunnel as well. I suspect the positioning won't be ideal for that either. It looks a little bit, once again, shallow. A CT scan will be useful in this patient to work out all the other factors. And I completely agree with you, the long leg is important, but let's assume it's a 12-degree slope. I think you have to have a discussion with the patient. For me, this patient doesn't do many cutting sports. They've got other things going on. They've got a ramp. They've got a lateral root tear. These will be obviously part of the instability picture. They've not had a tenodesis. It's a good discussion to have. If it was my knee, I'd be looking at getting a slope correction if I was this kind of patient. But really, most of my patients would probably err on having a revision ACL as a single stage with an LET. That's the reality of what I see.
Mirco?
Yeah, so I would go the same. I totally agree. So I think in this case, with the age, with the sports and everything, I wouldn't go for a slope correction with 12 degrees.
You will not?
No,
at all. No, I will not.
I wouldn't do that, but I would put an LET on top of that, and the tunnel would be I would do a CT scan. Just want to see the femoral tunnel is pretty far anterior, and the tibial as well. So therefore, but could be single stage, but depending on the CT scan.
We have a good question from the internet that asks the question about this 12-degree slope. Will the impact of this 12 thing will be different in the auto versus allograft? We don't like allograft in Germany, I know that. But
we don't get it, and we don't like it. But I wouldn't expect like a benefit if you have an allograft.
The scenario is worse.
Even worse. So I think
would you go more for a slope change if, for a reason, the only option is an allograft in this specific scenario? It will not change much for me, but I think it's a good question. And if we argue that the main problem with slope is the healing rate, allograft make it worse.
Yeah. So. But anyway, I think we have so many options. So.